Hello, and thank you for tuning in for today's briefing. Today, we're going to share our regular hospitalization data and talk a little bit about what we believe the next phase of the pandemic is going to be. Now, as you're going to see in the data, the number of COVID cases and hospitalizations are very low right now, which is really fantastic news. Life is finally getting back to normal again after that Omicron wave, and we're enjoying the progress we have made in our fight against COVID. At the same time, cases are rising in other parts of the world due to the new subvariant of the virus. And we're going to talk about that here in a little bit, about what that subvariant means for us and how we can prevent a future wave from disrupting our lives again and causing unnecessary illness and death. But first, let's take a look at some of our regular data. So we'll begin by looking at this slide, which is the number of admissions from task force hospitals. And this is from yesterday, March 22nd. And you'll notice that the number of daily hospitalizations is really very low. Yesterday, we only had 15 new COVID admissions, and that brings our 7-day moving average down to around 21 admissions a day. And we hope that this number is going to continue to decline in the upcoming days and weeks. Moving to our next slide, we're reporting 105 hospitalizations with confirmed COVID positive, that are confirmed COVID positive. And that moving average is now around 113 patients. So getting very close to dropping below that 100 patient mark. So as you can see, these are some of the lowest numbers of hospitalized patients that we've seen in the pandemic over the last 2 years. Moving on to our next slide, there's a little bit more detail about our daily numbers. Again, we have 105 patients hospitalized today with COVID. About 23 of those are in the ICU, and we have 17 patients on ventilators today. Moving on to our next slide, we have 15 hospitalizations today of suspected COVID patients, and we have 2 suspected COVID patients in our ICUs. The good news is we have no suspected COVID patients currently on ventilators. Unfortunately, as this next slide shows, we still are experiencing some people passing away from COVID. So although the number of hospitalized patients are low, patients are continuing to die from COVID. Today, we're reporting 2 COVID deaths from task force hospitals. The moving 7-day average, though, has moved down to 3 deaths per day, which we're glad to see. Our next slide shows a vaccination rate. So this shows that the number and percentage of patients who are vaccinated and those who are unvaccinated. 68% of patients who are currently hospitalized are not vaccinated. 32% are vaccinated and have breakthrough cases. Now remember, a lot of these patients with breakthrough cases have other risk factors like age or other medical conditions that really contribute to their need to be hospitalized. And we really show that in this next slide here, which shows the breakdown between vaccinated and unvaccinated patients over time. Now you'll see here that the number of admissions rises and falls. There are more consistently more unvaccinated patients than vaccinated patients. So again, reiterating, vaccines continue to be very protective against hospitalizations. Now we'll move on to our pediatric population. As this next slide shows, the pediatric hospitalizations have dropped considerably. We now only have 3 patients in the 11 and under group and only 1 patient in the 12 to 18-year-old age group. And I'm happy to report that we show no pediatric patients in our intensive care unit. Finally, in this next slide, our task force hospital discharges. Since April of 2020, when we began tracking all of this data, we've discharged a total of close to 42,000 COVID patients from our task force hospitals. A total of 23 were discharged in the past 3 days. Now that really concludes our regular data update for task force hospitals. But now we want to talk a little bit about what's happening elsewhere in the world and what that might mean for us. And for that, I'm going to turn it over to Dr. Clay Dunnigan. Clay?
Thank you, Alex. I think many people have heard that cases are going up in Europe again and wondering what's happening there. The rise is the result of this new subvariant that you talked about, subvariant of Omicron called BA.2. And it's believed to be even more contagious than the previous Omicron variant, BA.1. I think the latest information is it's probably about 50% more contagious. So the question is, what does that mean for us? It may mean that we'll see another uptick in cases here in the US. We've seen this pattern before with the different variants that have come along, Beta, Delta, Omicron. And that's really the nature of the pandemic. We're going to see rises and falls as the virus changes and becomes more transmissible. Remember that in this process, the main goal of the virus, so to speak, is to replicate. And so any virus that replicates better, transmits better than the previous one is going to win out and take over. And that's what we're going to see. We can't predict exactly if, when, or how this is going to happen. And we can't tell how it'll affect hospitalizations, which is a key data point. But we certainly could see a rise in cases, but not a significant rise in hospitalizations because of population immunity. Then there's really no telling at this point, but there are things we can do to prepare for the next phase of the pandemic. The next slide talks about what we can do in terms of proactive steps. It's within our power to make this next wave less severe and to prevent a variant from disrupting our lives again. We're in a good spot right now. As you saw in the data, the number of hospitalizations is very low, and people are enjoying getting back to normal life, and rightly so. We should enjoy the progress that's been made to date. At the same time, we can take some simple proactive steps to keep cases and hospitalizations low going into the future. First and foremost, and you've heard it many times, and we'll say it again, get vaccinated and boosted if you haven't already. So far, no matter what variants have emerged, the vaccines have produced good protection. We've become concerned with the passing of time because we know that a lot of at-risk people, particularly the elderly, were completing their two-shot vaccinations quite some time ago. For some, it's been over a year. And we also know that we have a relatively low rate of booster doses being completed. So when we look at those numbers, we become concerned that a new variant will combine with decreasing immunity in our most at-risk population. And that could really spell trouble that we can avoid with a booster dose. Again, the vaccines are extremely safe and work incredibly well to prevent severe illness, hospitalization, and death. But immunity does wane over time. So to be optimally protected, you need to get a booster shot if you've already been vaccinated. And it's not too late to start that vaccine series if you haven't had the first dose. It's especially important if you're older or at risk. These groups of the breakthrough cases we see in the hospital, almost all of them are at advanced age or have some disease that makes them more vulnerable. The other things you can do if you're at increased risk is continue to protect yourself with those simple public health measures like mask requirements and limits on indoor gatherings. Those things have been lifted officially, but you can still practice these strategies to stop spread. So if you are at risk, wear a mask, keep your distance, and avoid large indoor gatherings to reduce the chance you'll be exposed to COVID. The same is true if you're not at risk, but are spending time with someone who is. Remember, you can catch it. You may not even be very ill, but you can pass it on to someone who may suffer more severe consequences. So wearing a mask over your nose and mouth helps stop the spread of COVID and other illnesses like influenza. Finally, if you become ill, stay home and get tested quickly when you have symptoms. Testing will continue to be very important as we move into the next phase of the pandemic. Remember that we are in the tail end of the flu season too, and the flu and COVID have similar symptoms. You'll want to know which one you have so you can be properly treated. There are now good therapies available for both flu and COVID, particularly if you're at risk. Our hope is that these therapies will become more available in future COVID waves. And they're really quite powerful. The new drugs for COVID are proving to be extremely effective. But we need to have testing so that you'll know that you need to be treated. So again, as soon as symptoms appear, please seek medical attention, get tested, and then you can get therapy. So Alex, I'll turn it back to you to close up.
Great. Thanks, Clay. Now, as you said, we know these strategies work because we have practiced them over the last 2 years. Our community has worked extremely hard to bring COVID under control, and there's no doubt that the sacrifices we have all made have helped save lives and helped bring us to this moment of relative calm. So on behalf of the task force, we want to thank everyone for everything that they have done. And thank you for continuing to stay informed and to help stop the spread. Now, we'll continue to post updates on our Facebook page twice a week, and then we'll be back for briefings as we feel like they are needed. That concludes our briefing for today, and thanks for tuning in.